Are you wondering if your heel pain is plantar fasciitis and looking for ways to be able to diagnose your plantar fasciitis at home, as well as maybe some ideas on what to do if you do suffer with plantar fasciitis? Well, then today's video is for you. Today we're going to be talking about how to know if what you have is truly plantar fasciitis or if there's something else going on with your foot. And we'll also discuss what to do if you believe it's plantar fasciitis to help relieve some of your symptoms and eliminate your pain. So first, what is the plantar fascia? Well, we have fascia everywhere in our body, from the top of our head to the tip of our toes. However, we have some areas in our body that have really thick areas of fascia, and that's when they get a special name. So plantar fascia, or plantar fasciitis, is just the fascia that's on the bottom of our foot, the plantar surface of our foot. The iliotibial band is a thick piece of fascia that runs up the outside of the thigh. So it runs from the outside of your hip to the outside of your knee. Again, it's a really thick piece of fascia, so it has a special name, but we have fascia literally everywhere in our body. And fascia is really this somewhat thick surface that covers our entire body, kind of like a cobweb, except for it's thicker than that. So if you've ever had a raw steak and you've tried to pull the fat off of the steak or off of the meat itself, and there's that really thick fibrous part in between, well, that's fascia. And just like on your steak, you have it too throughout your entire body. Today, though, we're talking about the plantar fascia, which is that really thick piece of fascia that's on the bottom of the foot. And it's a really important piece of fascia because it helps our foot to be able to move correctly. So when we're walking, there's tons of bones in your feet, right? So you need to get them all coordinated, and the muscles help with that, and obviously the ligaments and the tendons help work on that too. But the plantar fascia is really what helps from heel strike rolling through that foot to toe off. And it's called the windlass effect, and it helps to keep all of the bones and the muscles, the ligaments, joints, everything in the correct position. So if it gets really stretched out, or if it gets really inflamed, or it gets painful, then you change how you're walking. You stop walking with a normal gait pattern, and you start to have some abnormal biomechanics, which means not only may you have foot pain, it may lead to knee pain, and then hip pain, and then low back pain. So anytime you have foot pain, we definitely want to deal with it as soon as possible because we don't want it to become a pain somewhere else in our body. So how do you know if you have plantar fasciitis? Well, the first test is always, where is the pain? Now with plantar fasciitis, I've got my little foot model here. With plantar fasciitis, the pain is going to be right on the inside in this kind of soft spot right in here. That's where you're going to feel the pain because that's right where the plantar fascia originates from. So this is a right foot, and it's on the inside right there. And if you put your foot right there and that's my pain spot, chances are pretty good that you have plantar fasciitis. But a couple other things to look for also. Usually plantar fasciitis, you'll have more pain first thing in the morning. So as soon as you get out of bed, oh man, my heels really hurt. And that's how people describe it most of the time. They don't say like, oh, right on the side of my heel hurts. Usually they describe it just as my heel really hurts. And usually that pain will decrease as you walk around during the day and everything like that. Often if you're, kind of up regularly throughout the day, you may not even notice it again until the evening. If you're sitting for a prolonged period of time, especially if you like to put your feet up and then you get up after watching TV or being on your phone or having your feet up for a while, then that pain will come back. Also, if you sit for regular periods of time during the day, so like if you're sitting at a computer all day, in an office or something, sitting for more than a half hour, usually that pain will start to come back, but it'll continue to ease as you move around on it. Now, a lot of people ask me, well, does this get worse with activity? Well, it does, but it doesn't. So it will actually become more painful with activity because you're putting stress through that plantar fascia and it's inflamed and it's angry, so it actually makes it worse, but you won't feel it while you're doing the activity. So while you're walking, running, jumping, anything like that, even biking, you won't necessarily feel any more pain. In fact, it may feel pretty good. But you may notice that if you've been walking, running, biking, or something like that more the day before, you'll notice it the next day. So you may have morning pain, but if you go do an activity, running, biking, something like that, chances are good that your pain will be increased the next morning, more so than would be normal for you. So it's not that you feel it right away. It's not that you feel it while you're doing the activity. You feel it a while after you've done the activity. Now, the other thing you can do to test to see if it's a plantar fasciitis is assess how your toes are moving. Now, this is a static model, so the toes don't really move very well. But what you would do is you would try to bend your toes backwards. And if your toes are like this and you can't bend them backwards, well, chances are good that you have plantar fasciitis because you should be able to, unlike this model. But what you're going to do is try to bend just your toes backwards on these bones here called the metatarsals. So this is the ball of your foot. So your toes should be able to lift up on the ball of your foot. And they really should be able to point almost straight up. So they should have enough movement to point straight up. If you have less movement than that, and it reproduces your symptoms, then chances are good that you have plantar fasciitis. And what's happening is that this motion here, so lifting the toes up, is putting more stress on that plantar fascia, which is causing more of the pain, which usually, again, originates from here. Now, this pain may originate here, but it can go all the way down into the ball of the foot. So we're actually going to do another video to discuss pain that starts in the ball of the foot and moves down, because that's technically not a plantar fasciitis. That's technically something else, because everything's got to have its own funny name. This is pain, though, that starts in the heel and may move towards the ball of the foot. Now, you may have also heard of Achilles tendonitis, which Achilles tendonitis is pain more in the back of the heel. So not so much the bottom of the foot, but the back of the heel, because that's where the Achilles tendon runs. And then it puts tension on the plantar fascia and causes a plantar fasciitis. So you can have Achilles tendonitis on its own, you can have plantar fasciitis on its own, but you can have them together. So it's complicated because there's a lot of things in this area. So want to be clear, if it started on the back of your heel, chances are good that it started as an Achilles tendonitis, and there's different exercises and things that you would want to do to treat that if that's the primary. What we're talking about today is plantar fasciitis, which is that pain that is primarily on the at least it starts on the inside of the foot, although it may travel if you let it get worse. So don't let it get worse and start treating it right now. So, how do you deal with plantar fasciitis? I will admit it's difficult and it's going to require perseverance. The reason why is that the plantar fascia doesn't have a ton of blood supply. Fascia in general in our body doesn't have a ton of blood supply. Not like muscles, right? Muscles have blood vessels going all through them. Well, the plantar fascia all fascia is around the muscle, which means it doesn't have a necessarily direct blood supply. It kind of feeds off of the muscle, which in most cases is just fine. But when there's an injury, it's much harder. Also, the plantar fascia is in the foot, which is really far away from the heart. And so it makes it really difficult for good blood flow to get down in there. So first thing we need to do is eliminate the inflammation. But we also need to keep in mind that this is going to be tough because A, it's our feet and we use them all the time because we're up and about, but B, it's a difficult area to heal because A, it's fascia, and B, it's far away from the heart. But the goal here is to decrease inflammation. So we want to look at what can we do to decrease inflammation. One is we can avoid weight bearing or being on our feet for long periods of time, particularly standing. So I will be honest with you that walking does not bother me as much as standing when it comes to plantar fasciitis. And the reason why is when you're standing, you're in that static position. When you're walking, you're moving, which means you're getting blood pumping through the muscles, which is going to help to bring more blood flow to the plantar fascia, which will help it to resolve quicker. So I actually like walking, although I don't like standing because you don't get the benefits of the increased blood flow with standing. Now, the challenge is if you sit for too long, it's painful. If you stand for too long, it's painful. If you walk for too long, it's painful. So it's really a matter of trying to keep everything kind of moving as well as you can by switching positions regularly. So you don't want to be standing for too long, you don't want to be sitting for too long, you don't want to be walking for too long. And I know that can be really difficult if like you have a job to do, or you have children to care for, or you have something else that you're supposed to be doing. So do the best you can to modify your activities as much as possible. If you can be sitting instead of standing for prolonged periods of time, that would be great to help take some stress off of the plantar fascia. Now, if that's just not realistic, you just have a job where you are standing for 8 to 10 to 12 hours a day, and there's nothing you can do, then you want to try to take as much stress off of the plantar fascia as possible, which means you're going to need some kind of orthotic or some insert or something like that to help take some stress off. For most people, I recommend that they start with either like a gel cushion just to help give them some more cushioning support to see if that works. If that feels better but isn't enough, you can go to an over-the-counter orthotic, so something that you can slip in your shoe that helps give you a little bit more support and take some stress off that plantar fascia. If that helps, which for some people that's all they need, is just getting that foot in a better position. But if you feel like, well, it's helpful, but I need more than that, then I would recommend going for a custom orthotic and making sure you get something that fits your foot directly. And that's especially important if you need to be on your feet for a prolonged period of time. So if you've got a job where you're standing all day, or if you're just running around after children all day and there's no way for you to sit down regularly, then I definitely recommend going through that process of gel insert to over-the-counter orthotic to a custom orthotic to make sure that your feet are really, really well supported. The other thing you can do to decrease inflammation is to get some ice on there. And I know it may seem crazy to be icing your feet, but what I recommend is that you get a disposable water bottle, something that has like some ribbing on it. You pour out some of the water or drink some of it, put the cap back on, throw it in the freezer for a couple hours, and now you've got not only the ice, but you've got a nice little massage, which is really helpful to kind of get things moving in the heel and can really, really make things feel better. So I like to ice massage just for about 3 to 5 minutes, especially on the feet. It can be hard to do because they just get cold, and that can be a little bit difficult for people. If you are really, really sensitive to the cold and it really bothers you to do that ice massage on your feet, I recommend wrapping up in a blanket or a warm coat or something like that so that your core body stays warm, because you don't want to have those muscles getting aggravated and getting tighter, right? Because that's not going to help increase the blood flow, which is what we want to do in the long term to improve the healing. But the ice, rubbing it directly on the heel, you can go through the ball of the foot too, but from heel through the ball of the foot, because you want to make sure you get that heel where that plantar fascia is originating. 3 to 5 minutes on each side. If it's happening on both sides, you only have to ice the side that you're actually having symptoms on. But if you start to feel like you have symptoms on the other side, then I'd recommend icing that too. Now, a lot of people will ask me, well, I did start having symptoms on one side and now I'm starting to have symptoms on the other side. What's up with that? If you started with symptoms on one side and now you're just, weeks later, you're noticing it on the other side, what's happening with that is that you're compensating. So you've got some kind of issue on one side, let's say your right side, and now you're putting more weight through your left side. It's been compensating for that right foot because you've been in pain for so long. Now, this is in comparison to if you start having heel pain on both sides. If you start having heel pain on the right and left side at the same time, that's a totally different issue, because chances are good that that is not actually plantar fasciitis. Chances are good that that's a nerve problem that's actually coming from your low back. And we know that because when we have symptoms down both sides that start at exactly the same time, chances are really good that it's coming from your low back as opposed to directly from the tissue that we're discussing. But if it starts on one side and you notice it weeks or even months later on the other side because it didn't get treated properly, then the chances are good that you do have a plantar fasciitis and it's not a nerve issue. So I recommend trying this icing. You can definitely do some calf stretching. Make sure you've got some supportive shoes, especially if you need to be on your feet for long periods of time. And you should notice that your symptoms start to ease within a week or two. Now, that doesn't mean that they will go away completely. You should notice that they're a little bit improved. And I usually have people check first thing in the morning, because that's kind of your litmus test, right? Is it better first thing in the morning? Because it's hard to tell during the day, because it often goes away in the middle of the day and you're like, oh yeah, it's better. And then at night you're like, oh wait, no, it's worse. It's hard to keep track. So I have people check in first thing in the morning, because that seems to be a good litmus test. And it should be feeling better within a week or two, at least a little bit better each day. Now, it can take up to 4 to 6 weeks to totally get this to go away. So I need you to be patient. As long as you feel like these techniques are working, I need you to keep going, because it's going to be really, really important to make sure you get this gone for good, because it's one of those things that it just comes back really easily if you don't completely deal with it. It's kind of like antibiotics. You know, the doctor says you have to take the full course even when you're feeling better. Yeah. Well, I need you to continue on with your exercises and continue on with your icing and use your orthotics and the tools that you have in place until your pain is completely gone. 100%, no heel pain in the morning. Now, if you've tried these techniques and you don't feel like they're helpful, I definitely would recommend seeing a manual physical therapist. What can happen for people is that they need help addressing why the plantar fascia became painful in the first place. So for a lot of people who end up coming into my clinic, it's because these simple techniques they tried at home, they didn't work even after 4 to 6 weeks, because they had a biomechanical problem somewhere else along the chain that was putting too much force through that plantar fascia. And of course, I can't diagnose that for you over video, but if you try these techniques and you don't find that they work, that's when I would recommend reaching out to a manual physical therapist to help find some answers that are more specific to you. Have a great day, everyone.